Dear viewers, welcome to Content Managers once again. Today we will discuss 11 remedies for prevention of gout. Before we embark on remedies of gout, let us find these answers. What is gout, its causes and symptoms? Gout is a form of inflammatory arthritis, characterized by sudden and excruciatingly painful attacks, typically in the joints, particularly the big toe. Gout is often associated with lifestyle factors such as diet and alcohol consumption. However, its complexities extend beyond mere lifestyle choices, involving genetic predispositions and metabolic imbalances. To effectively combat this condition, a comprehensive understanding of its mechanisms and proactive preventive measures are essential. This exploration delves into the multifaceted nature of gout, elucidating its causes, symptoms, and most importantly, strategies for prevention. The causes of gout. Number 1. Dietary decisions. Devouring food varieties high in purines can hoist uric acid levels in the body. Purines are normal mixtures tracked down in specific food sources, like red meat, organ meats, some type fish, and a few sorts of beans. At the point when purines are separated by the body, uric acid is created. Extreme admission of purine-rich food sources can overpower the body's capacity to discharge uric acid, prompting hyperuricemia, high uric acid levels, and expanding the risk of gout. Number 2. Alcohol utilization. Liquor, especially brew and alcohol, can raise uric acid levels and add to the improvement of gout. Over-the-top utilization of alcohol, particularly spirits like bourbon and vodka, has been related with an expanded risk of gout assaults. Number 3. Obesity and weight gain. Being overweight or heftiness is a significant risk factor for gout. Overabundance body weight can prompt insulin resistance and metabolic condition, the two of which are related with higher uric acid levels. Moreover, fat tissue, fat cells discharges substances that advance aggravation and increment uric acid creation, further adding to the improvement of gout. Number 4. Genetics. Hereditary variables assume a part in gout vulnerability. A few people might acquire hereditary varieties that influence the way their bodies cycle and discharge uric acid, expanding their risk of creating hyperuricemia and gout. Number 5. Medical circumstances. Certain ailments can incline people toward gout. This incorporate kidney infection, which weakens the kidney's capacity to successfully dispose of uric acid from the body, and metabolic problems. For example, diabetes and hypertension, which are related to insulin resistance and raised uric acid levels. Number 6. Medications. Certain prescriptions can disrupt uric acid digestion and increase the risk of gout. These incorporate diuretics, water pills ordinarily used to treat hypertension and cardiovascular breakdown, as well as prescriptions can imagine headache medicine and niacin. Moreover, immunosuppressant drugs utilized in the therapy of conditions. For example, malignant growth and immune system illnesses can lift uric acid levels and add to gout advancement. Now the symptoms. Gout can manifest itself in a variety of ways, and each one demonstrates the unique ways in which illness affects the body. There are common signs and symptoms of gout including: Number 1. Serious joint aches. One of the main signs of gout is severe joint pain, which is frequently described as sudden, intense, and debilitating. This pain typically affects the joint near the base of the big toe, but it can also affect the fingers, knees, elbows, wrists, and ankles. Number 2. Swelling and inflammation. During gout episodes, swelling and inflammation are common side effects in the affected joint. This inflammation is brought on by the body's immune response to uric crystals that accumulate in the joint and produce inflammation. Number 3. Comfortable to the touch. The afflicted joints may feel warm to the touch due to inflammation and increased blood flow. This warmth can make an attack more painful for the person experiencing it, as it is frequently linked to acute gout attacks. Number 4. Limited flexibility. The affected joint may have swelling, and it is extremely painful to move. making it difficult to do regular activities like walking or using your hands. Number 5. Formation of tophi. Tophi can develop in cases of persistent or untreated gout. Tophi are microscopic chalky nodules that can develop under the skin in different tissues or around joints. Failure to treat these nodules harboring uric crystals could lead to more joint damage and deformity. Number 6. The temperature. Low-grade fevers sometimes strike people, particularly during severe spells of gout. This systemic reaction is often brought on by the body's inflammatory reaction to uric crystals in the joints. Number 7. Lethargy and indigestion. Feelings of lethargicness and fatigue can arise during gout attacks, which can be incredibly taxing on the body and mind. Those with gout attacks may feel tired and listless due to the intense pain, inflammation, and irregular sleep patterns. Finally, the Remedies' number 1 dietary changes. Food assortments strong in purines, like red meat, organ meats, fish, and vegetables like asparagus and mushrooms should be eaten with some limitation. This could diminish the quantity of purines that are available to convey uric acid. Fish, especially anchovies and sardines and shellfish, may similarly be consumed with some restriction. Inquisitively, a new report suggests that diminishing purine-rich vegetables may not impact uric acid levels. Number 2. Fiber and L-ascorbic acid affirmation. Help your affirmation of fiber and L-ascorbic acid by eating more normal items, vegetables, and whole grains which are high in fiber in your eating schedule. By enabling waste flood, fiber helps control assimilation and lessening uric acid levels. Number 3. Hydration. Drinking enough water over the day will keep uric precious stones from amassing and lessen the gamble of gout assaults. Try to drink 8 or 10 glasses of water consistently. Number 4. Oversea glucose. High glucose levels can provoke extended uric acid. Based on normal whole food assortments and screen your sugar utilization. Number 5. Controlling weight. Reach and keep a strong weight. Diminishing extra weight could assist with cutting down uric acid levels and lessen the likelihood of gout attacks, especially accepting the individual is overweight or heavy. Number 6. Limit admission to alcohol. Limit your alcohol affirmation since it can raise your risk of gout attacks and raise your uric acid levels. Number 7. Medications. Drugs like probenecid decrease blood uric acid levels by working on the release of uric acid in the pee. Individuals who have rehashing gout attacks or cannot persevere through various drugs may be suggested these meds. Remedies, for instance, febuxostat and allopurinol block the xanthine oxidase impetus, as most would consider to be normal to convey uric acid. These meds decrease the risk of intricacies and help with avoiding gout attacks by lessening the advancement of uric acid. Number 8. Workout. To help with keeping a strong weight, overhaul spread, and advance general thriving. Take part in standard genuine movement like running, cycling, swimming, or lively strolling. In addition, exercise can help with cutting down uric acid levels and lower the event of gout attacks. Number 9. Control your stress. Expanded seasons of stress can fuel infirmities and raise uric acid levels. Participate in pressure decline practices to help mental and genuine flourishing, like yoga, significant breathing exercises, care reflection, and outside time. Number 10. Coffee usage. Incredibly, coffee usage is linked with lower uric acid levels. Assuming you are a coffee sweetheart, participate in some Joe. Number 11. Routine evaluations. Test blood as frequently as conceivable to assess uric acid levels. This will allow you to follow your turn of events and guarantee that any helpful movement is working. The final words. By putting into practice all-encompassing preventative techniques that include lifestyle adjustments and individualized medical procedures needs, healthcare professionals can empower individuals to effectively manage their risk of gout and improve their overall quality of life. That is all for gout. Do subscribe, like, and share with your friends and family for their benefits. Thanks for watching. Take care.